I will give you a brief summary of what we have been doing. If you are interested to have more detailed discussions, please feel free to contact me. My email is here. We can go through more detail. There are several different models. Why we need another model? A model is as good as its data and its assumptions. So when we look at the CDC page about developed models for a spread of COVID-19, when you look at the assumptions about the interventions, you see that some of them, they do not consider any assumption, like Imperial College model or a CAN model. Some of them consider that interventions will be there indefinitely, like MIT model. And some of them consider 20% in reduction contact or 30% reduction contact, like Columbia University model. Those assumptions about interventions are hypothetical. And when you have hypothetical assumption, you end up with having hypothetical predictions. And perhaps this is one of the reasons that even one of the most popular popular models was that is from University of Washington. It's called Mori model. They didn't have good predictions. They predicted 80,000 deaths by early August for the nation. Then they reduced it to 60,000 deaths on early August, for that matter. Then we reached that number by end of April, 3 months earlier. Then they changed the number again to 147,000 for early August, and a week or so after, they reduced it to 132,000. None of those models basically could have a realistic prediction of the spread of COVID-19 and its impact. In contrast, what we are doing, we are not making hypothetical assumptions. Our assumptions are modeled. So we use the data. We are using several data sets available there. And we are extracting factors. We do data mining. We apply data science methods to clean up the data and identify important factors. From the factors and other data sets, we set up the assumptions. So at the same time, we model what is going on right now. So it means that we model the trends of COVID-19. And then you see the trends which have been modeled, the assumptions which have been modeled separately, and other data resources all go to the middle box, which is a spatiotemporal prediction of COVID-19 spread. So then we have this prediction, and then using this prediction and some factors which are identified, then proactively we implement the interventions. It means that, okay, if from 1 month from now, this is the prediction for a number of cases and the deaths, now what are the interventions that should be implemented? And then after enforcing those implementation, we look at the new data. And we have the trends, the current trends, and then we fine tune assumptions, we adjust the factors, we will have new predictions, and this will be a spatiotemporal dynamic modeling for the whole nation at the state level. And then I will let you know that even not at the state is enough, and we need to go and have higher resolution. I'm going to show you the comparison between the trend between two states. This is basically a temporal model of the trends in New York State. And we are going to compare this with the state of Florida. Interestingly, these two states are very comparable. The population is very comparable, around 20 million. The population density at a state level is very comparable. And the interventions that have been implemented in very close dates. However, what we have seen in New York State is totally different from what we have seen in the state of Florida. In both states, New York State and the state of Florida, the patient 0 was identified on March the 1st. And actually, 2 patients were identified in Florida and 1 patient in the state of New York. It means that the number of patients, starting patients, was twice as many in Florida. So when you look at the trend for New York State and interventions, even as I said, the interventions are very closely implemented. A state of emergency, a state of New York, March the 7th, March the 9th in Florida, date banned visitor to nursing homes, March 13th, state of Florida, March 15th in Florida, and March 13th in New York. So, and as we see, those green arrows, they show the interventions that, and then you see we have a big peak in a state of New York, and then we have been on the falling side. The main difference now is that a state of New York or New York State has not opened yet, and still we are on the down side of the curve. But in comparison, we look at a state of Florida, we reached the peak, and it has been pretty steady afterward. And now the last two green arrows that you see is opening of the business. So on May 11th, that was mandatory mask for businesses, and May 18th, that gyms, restaurants, and businesses were opened. And we expect that to see this goes up again. So even for two very comparable states, we see that the trend is completely different. And this is suggesting that not only at the state level, but also if we look at what is happening in the state of New York and what happened in the city of New York, it's completely, totally different thing. So we are working at county level and considering several different factors which are dynamically set. And this is not only customized based on different counties. It can also be customized based on the impact on different, for example, the impact of COVID-19 on education, the impact of COVID-19 on healthcare, on economy, the impact of COVID-19 on readiness of military, and so on. So this is very ambitious undertaking, and we are very open in collaboration. If among the audience are people from local, federal, or state agencies who are interested in more detailed discussions, we are very open to talk to you. Please feel free to contact me. My email address is here. And now I'm going to wrap this up. Thank you.
Thank you. One question came in for the audience that we have time for. Based on your mathematical modeling and assessment of the daily cases and trends, which intervention do you find should be maintained as long as possible?
Good question. The thing is that what we are doing and what we are suggesting is basically look at what's happening right now and have predictions and implement the right interventions at right time. The thing is that, for example, the business cannot or the state cannot be closed indefinitely, right? In contrast with some assumptions that those models are considering. So I wouldn't say that we should consider any intervention to still there indefinitely. And I think that considering that we will have a vaccine by end of this year is very optimistic. We don't think that is going to happen. The main thing is that we need to learn how to live with this virus. And for that, how to live with, we need to have models that they can do good predictions and that they tell us, okay, how dynamically we should change the interventions. Okay, if you are going to open the estate, not at 100% based on what is going on right now, maybe you need to open the business at 25% level. So, and that is basically one of the main points of our model. Everything is dynamic based on what is happening. We are going to decide what we need to do.
Thank you.
Of course.